happy to preside over the launch of the kits for our community health promoters, CHPS. Here in Gusii County, we have prioritized community health services. So the issuance of CHP kits and funds will go a long way in improving service in the area of promoting, rehabilitating, and preventing health services through the CHPs, who are our first line of defense in healthcare. The legal basis of CHP's initiative is held in the National Community Health Strategy of 2006, which emphasizes a more proactive approach of bringing health services closer to their household. Studies have shown that for every 1 shilling invested in the community health, Kenya reaps equivalent of 9 shillings in economic and social benefits. This means that the CHP's initiative is the only sustainable way in achieving universal health coverage with minimum cost. To make it effective, community health is implemented through a community health unity, CU, which serves a definite geographical area covering a population of approximately 5,000 people or 1,000 households. Each unit is assigned 1 community health assistant and 10 community health promoters, CHPs. Each CHP serves 100 households. All community units are linked to health facilities. The service offered by a CHP includes advocacy, promotive services, best curative and rehabilitative services. CHPs supports all programs of the community level, very instrumental during immunization, outreaches, native distributions, identification of indigenous, disease surveillance, follow-up of patient, and many others. The Gusii County community health coverage stands at 100%. All regions have a community unity. We have 2,940 community health promoters, supporting 294 community units in the county. The 294 community units are supervised by 294 community health assistants and community health extension workers. I'm happy that all CHPs have been trained in all service delivery modules, and they are also recently trained in the electronic community health information system, that is CHPS. I hope you have been trained.
Yes.
And you are well prepared.
Yes.
Okay, na mimi nitafanya kazi yangu. Mnajua ile ambayo nafaa kufanya, si ndio? The kits and funds we're issuing were procured by the national government, and I thank the Ministry of Health for delivering the kits to Gusii. Today, 2,841 CHPs will receive a kit with assorted items, including a phone cover, and screen protector. The kits will improve the scope and the quality of service offered by CHPs, such as earlier diagnosis of diabetes, blood monitoring, CHP identity, blood pressure and monitoring, and so forth. The phones will facilitate the digital community health information system, enhance the capacity of community health workforce to effectively collect, collateral and report community health data real time. On CHP enumerations, and this is important, the county government commenced the payment of CHP stipends as way of motivating them. The national government has made plans to enhance this stipend by an additional of 2,500 shillings per CHP per month. And also, I know hapa lazima watu waululike. Si ndio? Pesa ijafanya nini? Tunaongea hiyo. Najua lazima mgululika hapa. In order to beef up community health services, we have established 2 primary health care networks in 2 sub-counties, and we are in the process of establishing other remaining 7 primary health networks. Allow me to mention one thing. I know you have just said, pesa ijaingia. Mnataka ingie? Sasa ndio dawa ya nini? Haya basi. Allow me to mention